In the previous tutorials, we went over a lot of concepts talking about processes, modes, and types of communication, principles of communication, transcultural communication, therapeutical communication. So in this tutorial, we're going to go starting with barriers to effective communication. Remember, this is not just any communication, but effective communication. Now, when we're talking about communication, we first have the sender who gets to encode the message, and the message is going to be decoded by the receiver. The receiver gets to receive that message. So at times there will be need for a feedback. The feedback can come from the receiver to the sender, and the sender can also again send another feedback to the receiver, and communication gets to go like that. But if there is noise between the sender and the receiver, that is going to be a barrier to effective communication. Of course, it might not just be noise as we know it physically. There are a lot of things that can act as noise to disrupt effective communication. And so let's get to start. The first is we're going to talk about physical setting as a barrier to effective communication. So effective communication has to do with someone getting in to interact with another instead of only one person getting to speak. So if it is supposed to be effective, at the end of it, we need to take something. That is why we are saying effective, not just any communication. So some of the physical settings that affect effective communication include seats, privacy, noise, and also interruptions. Now, how do these get to act as barriers to effective communication? So, if we talk of seats, imagine you are getting to communicate with this person and you are just standing. The whole time you are just standing. So, that acts as a form of physical setting barrier to effective communication. You can't just be standing and you are continually speaking like that. It can also be, imagine you are talking to a person who is 5 steps or 5 seats, 6 seats, 7 seats away from you. So because of that, that can also act as what, as a form of physical barrier to effective communication. Another thing is privacy. But a lot when you're talking about seats is when you just get to stand or something like that, it gets to interrupt your communication. And privacy, many times a lot of people would rather just reveal some information about themselves because they are not that comfortable with getting to reveal everything about them. So that also acts as a barrier to effective communication because it will be more like you are trying to hide some things. Also noise. So noise can be psychological or physical. Imagine in your brain there is a lot of things going on. So but here, since it is physical noise, this is where now just the background, there is a lot of speeches, there is music and a lot of things, so that gets to interrupt communication. And also just interruptions. Imagine you are talking and someone is just trying to talk to you again. You are talking to another person, another one is always calling your name, so that gets to act as a barrier to effective communication. Another thing is non-verbal behavior. So non-verbal behavior. What are some of the things that act as barriers to effective communication which are not spoken? That is just a behavior shown non-verbally. So the first thing is proximity, posture, okay, and eye contact. Apart from that, facial expression. We also have head nods. and also silence. So these are some of the things. You'll not be speaking, but someone can just look at you, and that can act as a barrier. Proximity as the first one, non-verbal behavior that gets to act as a barrier to effective communication. So proximity is just a distance between people who are talking. So imagine you are very far away from each other. That acts as a barrier because the further the distance, the more difficult it is for people to get to communicate. So that acts as a barrier to effective communication. It is very difficult for you to get to understand what someone who is very far is saying. And also posture, just the way you get to stand. Maybe imagine you are talking to this person and all they are doing is they get to hold their legs, they hold their waist, they do this, like they can't just stand in peace. So that gets to affect the way we get to communicate. So you need to make sure that you are in a good posture. Your positioning is good for you to have an effective communication. The other thing is eye contact. Other people wouldn't be that effective in communication when you are looking to them so very close, because there are some people who are very shy. So when you have that close eye contact with them, that might affect the way they get to communicate. For example, they might be feeling shy, and others maybe they're encouraged when you are looking at them as you get to speak. So that can act as a barrier to effective communication. And also facial expression. Imagine you are talking to this person and he's just looking very upset. The way they are just looking at you as if they don't even want to see you. So that also acts as a barrier to effective communication. Head nods. When you are getting to communicate to a person, imagine every time everything that you get to say, everything a person is just getting to nod the head. Even if they ask for the opinion, you still nod the head. So that can act as a barrier to effective communication, because how can you just be nodding every time? Okay. And also silence, and silence speaks so much. So when you are getting to communicate with other people and all you can do is remain silent, that is very bad, and that can really affect communication. So apart from non-verbal behavior and physical setting, there is also verbal communication. So when you're talking about verbal communication, here we need to understand about open-ended, closed-ended, leading questions, and also multiple questions. So we need to understand all of these. So what does it mean when we say open-ended? Well, these are basically questions also. So imagine you are interacting with people and you are getting to ask them some questions. Now these questions are mostly used when you are surveying, you want to find out something. What are open-ended questions? What are closed-ended questions? Leading questions. So open-ended questions, these are questions which are directed with an answer of, where you want someone to get to describe more, like it is open. That is open-ended question. So these questions are very difficult to answer with a yes or a no, because you need to describe, you need to say a lot of things about what you want to say. So open-ended questions encourage analog or monologue. You need to talk, not just saying one word. So examples of questions such as that is, how do you see your future? What do you think about him? Why did you choose this career? You can't just say, someone asks, why did you choose this career? You say yes. No, these encourage monologue, or they encourage that you get to speak more. So, such type of questions. Another one you can talk about is, tell me more about your children. tell me more about your school. Those are open-ended questions. They are open. You can say a lot of things. Now, when we come to closed-ended questions, these are questions which are usually answered with either a yes or a no. Mostly, there is no need of a description. So, they are typically factual questions of specific amounts, dates, and time. These are the types of questions. An example you can talk about is, are you feeling better today? You can't start describing. No, yesterday is not. They have asked for you to say about today, not yesterday. So these are closed-ended questions. You don't have a choice of starting to explain. So another example that we can talk about is, should I go after him? Is your answer final? Where were you? Where are you planning on coming? So most of these questions are just linked to a yes or a no. Those are closed-ended questions. Now, when we come to leading questions answer in part of the question. So you need to give an answer, but the question has been raised in such a way that the very thing that I want to find out, I put it in forms of a question. So an example that you can hear of is, were you in campus when this incident happened? So I want to find out if this person was in campus when the incident happened. So and I get to put that in forms of a question so that someone can answer. And mostly when you're interacting with people, it is not good using leading questions, because you are forcing them either to say just something that is direct. You are not giving them time to be able to describe. So most leading questions and close-ended questions don't give a person chance, and so they should be avoided mostly. So when you're talking about leading questions are most asked when you want to confirm about something you already know, but you really just want to confirm about what you already know. So those are leading questions. So another question that we can talk about when you're talking about a leading question is, were you with him last week? But instead of asking it like that, we are going to ask it direct. You were with him last week, weren't you? So you don't have a choice to say a lot of things. You can either say, yes, I was, or no, I wasn't. You didn't see the stop sign, did you? So those are leading questions. You don't have a choice of saying a lot of things. So a leading question is a type of question that implies or contains its own answer. It it prompts the one who is going to respond to answer in a very particular way. You don't have a choice. It is going to prompt you to answer in a particular way, and these questions are undesirable as they can result in false or slanted information. This is why you find someone saying as they are getting to answer, because you are forcing them to give an answer even if they don't know. So this is about the leading questions. Closed-ended questions, the main difference is they are mostly followed by a yes or no. Now there are also multiple questions. So multiple questions, this is when you just get to ask a lot of things at the same time. A lot of things at the same time. So this can act as barriers to communication. You can think of it, you are always asking a lot of questions at the same time, a lot of questions. And who does love that? Just being asked a lot of things, like someone gets wants to remove information from you. Those also get to act as barriers to effective communication. Of course, there's also another type of questioning that is there, which is probing questions. So when you're talking about these probing questions, you are just getting to talk about questions you want to have more clarification on. So if you hear of probing questions, so they are mostly asked at the end of a conversation so that you find out more about something. So for example, when someone was talking and then you ask them, can you clarify more? Can you say more about this? So those kind of questions are probing questions. So this is verbal communication. So another thing that can act as a barrier to communication, patient related factors. So, patient related factors. Now, these patient related factors can include things like physical symptoms, psychological factors related to illness. Apart from that, also past and current experience of care. Now, what do we think? How can these act as barriers to effective communication? Now, when you get to see symptoms in a person, like physical symptoms that a patient has, that can act as a what? As a barrier to communication, and that is going to limit you the way you get to communicate with those people. Imagine maybe you are talking of coronavirus and this person is showing symptoms of coronavirus. How would you even just come near them to communicate with them? You can use another mode of communication, but though, even if you can use, for example, a phone cannot be as much effective as a face-to-face interaction. So physical symptoms also get to affect uh, effective communication. And psychological factors, you can talk of those factors which are related to illness. They also get to effect or to act as a barrier to effective communication. Talk of someone, maybe someone is not that okay, maybe they've got some psychological problems in thinking, or they are getting out of their mind. So even the way you get to communicate with them might not be okay. Imagine you're talking to a mad person, your communication might not be that okay with them because you are not in the same way. So that those are psychological factors which get to act as barriers to communication. So those are patient related factors. And also the past and current experience of care. So if you don't have that enough experience to caring to for the patient, or that much experience in relations with the patient, you might not be a effective communicator with them. That is because, when you get to communicate with them, some things that they might be wanting cannot seem just normal as to you who is a normal person for a patient. So maybe they just ask for this, they ask for that, they ask for this. So if you lack experience with them, it might be just trouble for you, and so that can affect the way you get to communicate with them. So apart from this, also health practitioners related factors. So when we're talking about health practitioners related factors, this includes your training in communication or communication skills, and also self-confidence, personality, and also physical factors, and also psychological factors. So imagine as a health practitioner, you don't know much about the training, okay, the training in health relations, or just the way you should be able to associate with your patients. So if a nurse, a doctor, or any health practitioner does not have a training in communication skills, it might be very difficult with them communicating with patients because they lack that skill. It is a skill that can be gained, and so that can act as a barrier to effective communication. And also self-confidence. If a health practitioner doesn't have that confidence to speaking or to interacting, that can have can act as a barrier to effective communication. Imagine you're talking to this person who is sick and you lack confidence in yourself as you get to speak with them. You might be maybe feeling shy, or you can even be shaking because you don't have that confidence or the ability to communicate with people. So that can act as a barrier. And also physical factors. So physical factors like the environment in which you are can also get to act as a barrier to communication, and also some psychological factors such as the people you are trying to relate with or speaking to or communicating to, or even just yourself if there are some psychological problems going on in your mind. So that can also get to act as a barrier. Apart from that, there's also social cultural factors. Okay. Social cultural factors, this is just your beliefs, religious beliefs, and just some other things that you get to believe in. So imagine you're talking to this person who is a Muslim and you're a Christian. So maybe you might not come to terms. So that can act as a barrier to good communication. That is from you yourself as a health practitioner. Apart from that is lacking knowledge of the subject matter. What you are talking about or what the patient is asking you about, you don't know about it as a health practitioner. So that is going to act as a barrier. Imagine you are more you more did your study in one part, maybe on how to work on the heart, and then the patient gets to ask you about kidneys. If you don't have more knowledge on the subject or the matter, that can affect the communication. And also the presence of people as a health practitioner. So if there are a lot of people there, that can also act as a barrier to effective communication. Imagine there are some personal things that you want to talk with a patient. Maybe they told you something the previous day and you want to answer them today. So because there are a lot of people, you might not be able to speak to them because of the presence of people. Okay. So apart from these which you've said, which are health practitioners related factors, there's also psychological barriers. Sorry, not psychological really, but physiological. This is from the physical. So what about the physiological barriers? So this includes difficulties in hearing, difficulties in vision, and also difficulties in expression. So this can act as barriers to effective communication. Imagine you can't hear well. That is going to really affect the way you get to communicate. Imagine your vision is not that good, and someone maybe as you are getting to communicate, they are using some visual aids, maybe a chat or something like that. So that can affect also the communication. So these are physiological from the physical. And also just lack of expression. If you are one person who cannot really express yourself, so that also acts as a barrier to effective communication. All right, so this is about barriers to effective communication. Now let's talk about facilitating communication. How can you facilitate communication? How can you make sure that communication peradventure can flow smoothly? So the first thing, you need to think of how you want to be treated as a patient. So even if you are a health practitioner, imagine you think of yourself when you became a patient. How would you want to be treated? What would you like people to treat you like? So that is very very important, because when you get to put yourself in the even in the shoes of the next person, that can help you to know how to get to treat even others. So think of how you would want to be treated as a patient. And also very important, respect. So you need to make sure that you respect the patient. In respecting the patient, this means when you get to talk with patients for the first time, introduce yourself. Because how do they know maybe you're just a stranger that has come to do harm to them? That is why always you also need to have an idea as a health practitioner as you get to move around. So introduce yourself, Also, explain your mission. What is your role? What is your profession? Why have you gone to see the patient? How long are you going to be with them? So explain your mission. And also shake hands. It's very important. That will just show warmth. It will just show a courtesy to them. Shake hands. Say thank you to them. Greet them. Just be that social to them, you see. And do not force physical contact. If they are not that much good with shaking hands, don't force that on them. And don't force physical contact. That is having respect. And also, if patient seems comfortable uncomfortable, call in adult relatives. So if they are not feeling comfortable, you need to call their relatives, and this should be adult relatives so that they come to maybe talk to them. Okay. And also, you need to call patients by their surname. Do not use their first name. For example, here I am Mwansa Msenge. So when you want to, I am a patient and you are working on me, don't call me by my name Mwansa. Call me Musenge. And to be just that respectful, if even if it is someone who is small, it is no sin you putting Mr. there, Mr. Musenge, or just getting to say sir or madam, but just get to make sure that you show that respect. And that respect in health practitioner is just get to mention someone on their surname. Okay. And the other thing is maintain privacy. Very, very important. You need to make sure that you get to maintain privacy. If these people have been that open to get to talk to you, don't take it for granted. Maintain their privacy. It is very important. So, another thing that we need to do to facilitate communication, we need to make sure that our physical appearance matters. So make sure that your appearance is well. Not no, we don't care about what is on the outside. A person is just on the inside. That isn't good. So the appearance should be good. So maintain a professional appearance. As a medical doctor, as a nurse, as a pharmacist, maintain a professional appearance and also a professional dress code. Imagine you put on a slit that is so big and you are working on patients. That can cause a lot of confusion. So make sure that your appearance is good, your dress code is good, and also inspire confidence. Show that you are confident even in your dressing. Inspire confidence. Okay. And another thing that you need to make sure that we get to do is make patient comfortable. You need to make sure that the patient is comfortable. So the way we get to interact with the patients, we shouldn't be that much so that we start making them to feel uncomfortable with us. Make sure that they are comfortable. And it is very difficult to realize that you are making someone uncomfortable, but we are able to see. Most of the times we just do it from purpose, but we are even able to see that this person is not comfortable with me. So whenever someone is not comfortable, make sure that at least if you can tell, you stop whatsoever that is making them uncomfortable. So sit at the patient's level. As you get to sit at their level, not where you sit more above them or more below them. Sit at their level. And apart from that, be aware of the patient's personal space. So when you are standing near the patient, know also their personal space. Because just a space that you stand near a person to means a lot of things. When you get to stand about just half a meter, 0.5 meters near a person, that shows intimacy. So it means you are intimate with them, or I'm getting too close to them. That is 0.5 meters away from person, just half a meter. You are so near to them. And when you get to stand about 1.2 meters away from a person, that is going to show just a personal talk now, just a relationship that you have with that person. Not really intimate, but just personal. Like you want to interact with them at a personal level so that not the whole group knowing. Now, when you get to stand about 3 meters away from a person, then now that would be social. Even the conversation that you are talking about with them, a lot of people can hear about it. So which level of talking are you interested in? Obviously, you shouldn't be intimate with patients. And the very best is getting to be just personal with patients so that you talk to them one on one. Now imagine they reviewed something to you and you are talking to them 3 meters away. That is going to be social. A lot of people are going to hear. You start shouting, hey, your ARVs are here. No, that wouldn't be good. So we need to make sure that we are aware of the patient's personal space. Apart from that, we also need to make sure that we get to build mutual understanding. So get to build a mutual understanding between yourself and the patient. So use active listening. Very, very important. Active listening. You need to use it. Active listening has to do with you getting to pay close attention to what they are saying and get to contribute when it is necessary. Don't interrupt when they get to speak. Listen to them and get to comment when they finish speaking. And also ask for clarifications. That is very important. That is having a mutual understanding. When they get to speak to you, get to ask to them, to ask them, what is their opinion? What are some things that you do maybe suggest? What is Just get to relate to people like that for clarification and everything. And also demonstrate understanding. That is mutual. Demonstrate understanding. Not where you start now arguing. That is not good. Avoid assumptions. Why is this person so much hate? Maybe he's a thief, maybe he's this and that. To have a mutual understanding with people, we should be people who are free from assumptions. Don't assume that this person is bad. Even if you can see them with lusters in their hair, you can see them putting on damaged clothes. Maybe they just don't have proper clothes. Have a heart to demonstrate understanding and not judgmental. So avoid assumptions and also state difficulties and concerns that you might be facing. So you should be able to state those. So this is about facilitating communication. So another thing that we need to have is interpersonal relations or interpersonal relationships. So at interpersonal relationship, this is a strong relationship and a deep relationship or a close association between two or more people. So this is now where you get to interact with people closely at a personal level. Okay, closely and deep. You get to interact them one on one, you and them. So that is an interperson relationship. Now, social associations, connections, or affiliations between two or more people is what we call also as interpersonal relationships. So this can be social associations. Maybe it is in this kind of grouping. Is it maybe just in that very same hospital or clinic or in a church? Just the way you get to associate socially with people, the connections that you have with people, and also just the way you get to help each other. That is a personal relationship. So how each person communicates internally provides a source of meaning. How are you able to communicate with people just internally? So within a closed circle where there are just a few people, how are you able to communicate with people? So imagine how close are you able to talk to this person? Okay. So that provides a lot of meaning and it shows how close you are to people. All right. So now, as health workers interact with different people, there are a lot of people that health workers get to interact with, and that is why we need to maintain even some interpersonal relationships. Some people that health professionals get to interact with include patients, patients' family, health team members, apart from health team members, also just the community at large. and also just vulnerable groups. So those who are vulnerable, they're vulnerable. So that is why there's need to develop interpersonal relations as health professionals. That is because there are a lot of people that you get to interact with, and some of these you need to interact them at a personal level. Think of just a vulnerable. Even if you can't interact with them as just a doctor or a nurse, there's just some form of help that you need to give them personally. So that is why you need to interact with the people at also a personal level. And so just here some functions of health interpersonal. What are some of the functions of interpersonal health relationships? So it is very, very much important to have interpersonal health relationships with patients, patients' family, and just your fellow health professionals. That is because one function of this is it facilitates teamwork. When you get to interact with people, that is going to facilitate teamwork. You are able to work together because you have got those interpersonal relationships with them. You will not just work with them when it is at the same place of work. Even when they get to go outside the place of work, you are able to interact with them, and also creating a supportive working climate. So the importance of being close to people at a personal level is even for support as you get to work. And also that gets to motivate individuals. So if you get to interact with people at a personal level, there are others just get motivated by the way we get to do something. So that is the importance of getting to associate with people at a personal level. It is a motivation, a very, very big motivation. And it also provides effective coordination. When you get to interact with people at a personal level, you are going to have an effective to join really. And where people are joined, even when there's a very, very big task, it will not be that difficult to be able to break. So it is very important to develop interpersonal relationships, either with just health professionals, with patients, and with many more for all these functions which you have here. Well, thank you so much for being present in this tutorial. Hope that was helpful and stay blessed.